I'm Helen Wraith. I'm Programme Manager in the Service Improvement Team at Calderdale CCG. Last year I led a Frailty and Falls project, which was a really good opportunity to work across multiple stakeholders to improve falls prevention for people who were living in their own home. Around 12 months ago I was approached by the Fire and Rescue Service, who were at that time undertaking home hazard risk assessments for smoke alarms in people's properties. They'd seen an opportunity to expand the checklist that they were undertaking to include aspects of health. Working with the Fire and Rescue Service, the Falls Prevention Service and the Staying Well coordinators, we developed the Safe and Well checklist, which was piloted in the Upper Valley in December last year.
My name's Jeff Shaw. I'm Watch Manager in charge of Blue Watch at Tobberton Fire Station based in the Upper Calderdale Valley. About 9 months ago we were approached by our district management team with a view to assisting our partner agencies in social services and the NHS. With specific regard to improving the way that we deliver our home safety checks. Historically, what we've basically done is gone in, checked people's houses for smoke alarms, given them some fire safety advice and fitted free smoke alarms where we have been able to, and then left. And there's been a gap in the market spotted where we've got good access into people's houses. It's generally been perceived that we've got a friendly disposition, and we'll turn up with big red and shiny with blue flashy lights on top, and when we knock on people's houses offering free advice and safety checks, people tend to let us in. So we've been working closely with the NHS, Gateway to Care, Social Services, Age UK, etc., a lot of partners to improve the way that we deliver our home safety checks. And one of the things that we look at now is falls prevention. And while we're not experts in assessing people for the risk of fall, we do have a little bit of knowledge and space on our new paperwork that highlights a need where somebody may be at risk of falling in the home. And if we highlight any of these areas, either after a fire or as part of one of our Safe and Well checks, we've got a direct referral now into the social services and into the NHS.
The outcomes so far have really been about the improved quality of referrals being made through Gateway to Care into falls prevention and for home adaptations such as handrails. Following the pilot in the Upper Valley, Safe and Well checks are going to be rolled out across Calderdale. This will be a real benefit for our frail elderly people living in their own homes in Calderdale, and it also starts to address the issue of tackling social isolation and loneliness.
If we can highlight the people that are vulnerable and prone to these falls before they actually fall, then it's a win-win for everybody.